And so now we're going to provide you with the same information. So can you tell us what's going on with the numbers in regards to COVID-19?
Yes, I wanted to share that the data about the numbers is that I was very shocked yesterday or this morning when I saw the numbers because as we talked about last week, our case numbers have been increasing. For a while, a few weeks ago, I was telling you 70, 80 cases in a day, 90 cases. And then last week it jumped up like to 253, 290, along those numbers last week. And I was concerned and I thought maybe that was like because of Thanksgiving. But then yesterday, in the last 24 hours, we had 606 cases in one day. 606 cases, which is dramatic increase of cases. And so I don't know if that's part of the Thanksgiving jump, that happened, because people have been getting together
Mhm.
that don't live in the same household, even though we've been telling people, please don't gather if you're not from the same household. But during Thanksgiving, we know there's families that did that and friends that did that anyway. So we don't know. And we'll have to kind of continue looking at numbers and see if it's related to that. But still, it's very dramatic and scary to see those numbers that are so high because our hospitals can be overburdened. We talk about ICU capacity. In the Bay Area region is now lower than the 15% threshold, for the order. I think we're at 12.9% or something ICU capacity throughout the region. Which is hard for our community. When you see these high numbers, we don't want to overwhelm our ICUs and our hospitals. We're talking about bedding shortage. We don't want to see that. We have staff, a hospital staff that is already working very hard. Do we have enough staffing to staff up if we need to? I don't know if we do. That's those are difficult things. We don't want to see that. So the numbers are not looking good right now. But that's why we're doing everything. We're now entered the order, stay home order, so we can do everything we can to stop the spread of the virus and do everything else to stay safe.
Definitely. And then the other piece that I think, again, and I agree with you, which worries me about the upcoming holidays next week, because I know that some people will want to go travel and visit family. And again, one of the things that we said in preparation for Thanksgiving, and that was it's better to spend that time using Zoom and connecting with people that way than to spend Christmas, for those who celebrate that, in the ER or the ICU. But again, so for me, there's a huge worry about what's going to happen next week if people are going to go and visit individuals. I've been talking with some people in the street and they tell me, well, I was thinking about renting a place in Tahoe. Other people say, well, yeah, we're just going to go, but it's going to be a short period of time and then we're going to go back. Well, with COVID, it's not about how long you're there, it's just about is somebody touching surfaces, is somebody talking without a
Mm-hmm.
mask on, all of those things, and that's it. It takes only a minute. And so
Yes.
it's really worrisome for me. And I think that, again, we need to be more cautious because if it continues to get worse, it's going to, the county may have, or the state may have to
Yes.
make other arrangements.
Yes. I mean, I just learned yesterday of someone that I know that has COVID, and the person doesn't know how they got it.
Yeah.
All they can think of is I was putting gas in a car or I went to go pick
Yeah.
up some tacos, but I don't know where I could have gotten it.
Yeah.
And so it's just really scary that you're right. Any kind of thing, if you just don't wash your hands, you pick it and then you touch your face or something, that just a slide of something like that can infect you. It's very scary. Mhm.
Exactly. And that's why, again, for those of you who are watching the video, I'm here on the radio, but for those of you who are gonna watch the video maybe later, I'm wearing the mask while at KBBF, and we wash our hands repeatedly because there are other people who come to KBBF, and if I have it, I don't want to give it to anybody, and if somebody else has it, I don't need it, right? So we have to be careful. This is our duty to educate the community, but we have to do it as safe as possible. And so with that, I want to move to our last point that it's important. Actually, I want to hear about Cuda. Can you give us a little bit of information about Cuda, and then we'll finish with the positive for today, since
Yes.
usually we don't have that many positives, but today we do.
Yes, the Cuda project is a program that the county supports through the On the Move nonprofit. And so Cuda, they are a great resource, and everyone needs to have their phone number. So if you hear of anyone that needs help with COVID, and not only if they are directly infected by COVID, in that way, but even if they were affected by the pandemic in some way, and they really focus on Latinx and Indigenous communities. So if you know people and you want to refer them to Cuda. For example, they have two different pathways. They help people with services, supportive services, like food distributions, free COVID testing, legal support for the paid sick leave, and other kind of resources. And if for people that need help with isolation or quarantine, they also provide those type of services. They will help people to connect them with the isolation services. And they also will assign like a caseworker. So they have caseworkers, they'll assign casework that work with the individual or the family that's been affected, and they'll help provide them, connect them to medical services, to food services, to any kind of help that they need. So let me give you that number. That number is 707-309-8972. So that is Cuda. And Cuda, there are collaborative of programs, including Nuestra Comunidad, La Luz, Corazon Hillsburg, Humanidad, Undocufund, a lot of different groups together that are working in conjunction together to help the community through this way. So yeah, again, that's a great program, and keep that number for anyone that you want to refer, especially in the Latinx and Indigenous community.
And then before we move to actually the positive, can you give us the phone number in case we see that a business may not be following protocol,
Yes,
whether there's a restaurant, a store, that's still happening all the time. What is the phone
yes.
number that we can call?
Yes, we have a phone number for non-emergency violations. So when you see a violation, like we said at the store, somewhere people aren't following the protocols, not following the order, the health order, the number to call is 1-833-723-3707. So they can call that number 24/7. If there's no one there, you can leave a message and they'll follow up. But the number again is 1-833-723-3707. And that's
Good.
the county line. Mhm.
Thank you for that. And now moving to the positive to finish our report today, the Pfizer vaccine has made it to Sonoma County. What can you tell us about this?
Yes, it's very exciting. Around 8:30 or 9 o'clock today, we received the first shipment of Pfizer vaccines. So between today and tomorrow, we're receiving a total of 4,000. How much was that? I'm sorry. A total of 4,875 doses of the Pfizer vaccine. So we start receiving them, and so what that is composed of is there's boxes of like 975 doses in each box, and so we are giving one box to St. Joseph Health System for Memorial Hospital and the Petaluma Valley Hospital, one box to Kaiser Permanente, one box to Sutter Health, including Hillsburg Hospital and Sonoma Valley Hospital, and then two boxes for County Public Health for our crisis stabilization unit, mental health services, and any kind of other county kind of programs that we need to immunize. So, part of the first step is that we're starting to get doses. Like I said, we're getting like around 5,000 between today and tomorrow. And we're starting with our first responder healthcare providers. So our doctors, our nurses, people that are frontline, they're working with COVID patients. So those are the ones that we're starting with first. The people that are working frontline at the hospitals with the patients. So we're starting first with them, and then we're moving on to the different tiers. We have like a tier system that we're going to be working on. We will be having more information about that system, the tiered system that we're going to be using. But we're starting with our healthcare providers, and then our senior care facilities and elderly people, and then we're going to move to like essential workers. People that work in stores, and just a lot of essential workers. So we will roll out more information around mid-January about that about our vaccine information. But that's kind of a start. So we started with Pfizer, but on the 21st we're going to start getting once the FDA approves the Moderna vaccine. So we're going to be expecting about 5,000 doses to begin with from Moderna. So we're going to start getting like every week or bi-weekly doses. And it's going to take a while, Rafael, for everyone to get vaccinated, because I'm ready to get vaccinated, because I think this is the hope that we have. And I think it's similar to like smallpox and other things that we, back in the day, we had to have a vaccine, everyone got vaccinated. So now we pretty much eradicated. So I think it's going to have to be the same thing with this, that something new that we'll have to get used to, that, okay, we have to go through this process so that we can go back to living in a society as we were used to, but we can't right now. And even with the vaccine, because it's going to take a while to vaccinate, get through all the levels and tiers, and vaccinate everyone, we have to continue with the COVID protections of using our face masks, keeping our distance, washing our hands, just everything that we do now. We have to continue just until we get through all the phases of vaccination. And like I said, these are both very effective vaccines. I think they're at 95% vaccine with very minimal side effects to it. That I think it would be good. It's just going to take us time. So we just ask for patience from the community, so that we can get through this. It's going to take many months to get through this, but we have to kind of work together to kind of reach our goal.
Definitely. And with that, as always, I want to thank you for
Of
again
course.
taking the time to be with us today. And I think as positive things keep coming up, we'll continue to report that. And I hope that if I don't see you in the next couple of weeks, I hope that you have a couple of days off. You've
Thank
been
you.
working for a long, long time. I think you work as many crazy hours as I do, because I send you text messages sometimes late trying to get information, and you're
Anytime,
always
Rafael.
responding.
Yeah,
But
anytime.
I appreciate that. And with that, I want to thank you again for being with us today here on KBB.
Thank you, Rafael. Have a good weekend.
You too.